Hi guys, Dr. H here, your source of advanced musculoskeletal care. And what are the odds that you just have a bad back? Let's talk about that. So let me set the scene for you. You've got a 40-ish year old patient who is experiencing some back pain. They go to see their doctor, maybe they get some physical therapy, maybe they get some x-rays in the beginning, nothing much comes out of it and the back pain doesn't go away. Eventually what I'm getting to is down the road they get an MRI of their back. And this MRI shows a hot mess. They have herniated or bulging discs, they have osteophytes in their back, they have something called neural impingement where the area that the nerves come out of your spine is being compressed and so you're getting sciatica-like symptoms down your legs or something like that. And their doctor says something to them like, wow, this looks like the back of an 80-year-old, that's your problem. And the problem is that the patient says, well, that doesn't quite make sense. I haven't really had any trauma to my back. I haven't really done anything that was too hard on my back through the years. I work at an office, so on and so forth. Why do I have the back of an 80-year-old at 40? And the all too often common response is, you just have a bad back. As if they somehow lost a cosmic roll of the dice, and when they were handing out backs, they handed a bad one out to this person. And so this patient ends up in my office, and I walk through the door and ask, how can I help you today? And usually the first thing I hear is, well, I don't know if you can, doc. I've been told I just got a bad back, but here's the situation. So this is a common misunderstanding that I have to address with my patients when they come to usually see me for the first time, which is just because all of this stuff appeared on your MRI doesn't mean you just have a bad back. There's a reason for this. More likely what it is that it's been years of your back trying to be a good back instead of a bad back. It's trying to act as the keystone of your body, which is what your back does. And it's trying to adjust for all kinds of other problems throughout your body. So a lot of what I'm going to say in this video relates to this concept of tensegrity. Now I made another video about tensegrity that I'll link right up here. And I highly recommend that if you haven't seen that video that you stop this video now, go take a look at that one, and then come back to this one. Because a lot of what I'm about to say may not make much sense if you don't understand this concept of tensegrity. Today I want to use this model by the same company to try to teach the same thing. But it's meant to represent sort of a simplified model of the tensegrity of the spine. And so just like the other model, you can see that you have these rigid structures here that's meant to represent your vertebra. And they float within this flexible system of rubber bands in this case, meant to represent the soft tissue around your spine. So when tensegrity is working in the spine, all of these vertebrae here are kind of held away from each other. They're just suspended. Even if I kind of compress down on this model, or I twist on the model, or do things that are similar to what your back would do, they don't really ever touch. So what happens is, this is a model of the tensegrity of your spine, whereas we talked before that the whole body has this sort of tensegrity model. And if things elsewhere, sort of downstream from your spine, if you will, your shoulders, your hips, even your head, have problems, maybe you have shoulders that are anteriorly rotated, maybe you have a head that has what's called an anterior head carriage, where your head is stuck forward like this. All of that disrupts the tensegrity system of the whole body. And it's your spine's job, being in the midline, being sort of that keystone system, to adjust. So for example, if you have an anterior head carriage that we already talked about, where your head's sort of forward like this, your spine will have to sort of extend in the thoracic region, where it's not really meant to be an extension, to bring your eyes back up level with the horizon so that you can function properly. When there's so many adjustments that your spine is having to make for other parts of your body being out of whack, when its own tensegrity system starts to break down, it goes from being suspended like you see in this model to being stacked on each other like bricks, which is what we don't want in the spine, because then you are putting pressure on your discs. You can get bulging discs and herniated discs. And sure enough, when you go get an MRI of your back, they find all kinds of degenerative changes there that could be considered problematic. But not too long ago, a study was done where they MRI'd a bunch of healthy people who did not have any back pain whatsoever. And they found a good majority of them had something in their back, a herniated disc, a bulging disc, osteophytes, degenerative changes, so on and so forth. The things that may have been blamed for your back pain were in a bunch of people who didn't have back pain. So this goes to show that maybe these findings of degenerative changes, of herniated discs, are more incidental than they are the cause of your pain. A lot of patients that I see who come and complaining of back pain, especially if they've seen other people who do kind of body work, like massage therapists or physical therapists, say when I went to see these individuals, they told me that I had like the tightest back they've ever seen. It's funny, a lot of patients tell me that. A lot of people have the tightest back that people have ever seen. But what's really going on there makes a lot more sense if you understand it from a tensegrity perspective. If the back is being twisted and turned to adjust for other problems, the muscles around the back are going to have to tighten in order to maintain that structure, and it's going to make your back very, very tight. And it's going to make your back very, very sore as well. So I have a lot of patients who come to see me for back pain that describe their pain as more of a soreness or tightness in their back, which doesn't quite fit with like a discogenic pain, the type of pain you would get from a herniated disc. Yet it's been herniated discs that's kind of been blamed for their pain in the past. In reality, what it is they have dysfunction elsewhere that's causing that tensegrity of their back to be disrupted. And as a result, their muscles are tightening and constricting and trying to hold their back still. And that's causing them to be sore, just like any muscle would be sore if it had to work overtime or had to work all the time to maintain your posture. So the point is, odds are you don't just have a bad back. Actually, the reality of the matter is you might have a very good back. Your back is trying to do its job. You have all these dysfunctions elsewhere, and your back is working really, really hard to keep your structure and function so that you can function in everyday life without problems. Your back isn't bad. Your back is trying to be the hero you need. It's trying to adjust itself for all the other problems throughout your body. And as a result, it's taking a lot of wear and tear onto itself. But they've done studies that show that people who have herniated disc symptoms get improvement after spinal manipulation, which wouldn't necessarily make sense because what is manipulation doing to the disc? It can't actually fix the disc. I mean, there's no technique I can do that we're going to pop your disc back in. But what it is doing is restoring that tensegrity. So again, talking about that patient in the beginning, I hear this a lot. Doc, I just have a bad back. One of the reasons I wanted to make this video is to help have a longer reach in dispelling this myth that it's really your back that's the problem. So many people think that once they're told they just have a bad back, they're going to have to live with it for the rest of their lives. That's their life now. Their back is bad, they're going to have to deal with it. And that's not necessarily the case. So if you've been told, or you know someone who's been told that you just have a bad back, it might be worth seeing a musculoskeletal specialist to see if there's anything else that can be done to restore that tensegrity, take the pressure off the back, and maybe get you some relief. So hopefully that helps with understanding why some people have back pain who maybe don't have a history of trauma to their back or back injury or anything like that, and they certainly don't just have a bad back. That's it for this video. I'll see you next time, and in the meantime, keep moving.